Hello, everybody. Thank you for joining us today. We'll just wait a couple minutes for everybody to join this meeting. Welcome, everybody. Thank you for joining this webinar today on the WA Cares Fund. Today, we'll be covering care options with WA Cares. My name is Logan Sargent. I'm the Outreach and Language Access Lead here at the Department of Social Health Services. Today, I'll be joining this presentation with Chantel Diaz, who's the Provider Policy Network Development Manager, Kristen Kane, Provider Network Development Program Manager at the DSHS, and Janice Taddeo, who is the Benefits Authorization Program Manager. So we'll go ahead and get started. The DSHS customer care team will be answering questions in the Q&A function during this presentation. Anyone who has joined us on a computer or using the Zoom app on their phones can submit their questions to the Q&A function at any point in time in the presentation. If you are unable to answer your questions during the allotted time, you can email us your question as well. There's simultaneous interpretation available during today's presentation. You can find the interpretation feature at the bottom of the screen to select the language. This webinar will be recorded, and the recording along with the slides will be available on our website at wacaresfund.wa/webinars within 24 hours of completion of this presentation. All right, well, we'll go ahead and get started on giving you a brief overview of long-term care. A program like the WA Cares Fund is needed just simply because the way that we've been paying for long-term care up until now simply is just not working. Studies show us that 70% of us will need long-term care at some point in time in our lives, and just the majority of us cannot afford it. Cost for 20 hours in-home care per week is around $23,000 for 6 months. And other types of long-term care can even be more expensive. The median household income for Washington State seniors is around $69,000 per year, and really family caregivers have to step in to fill that financial gap, either with their own savings or providing unpaid care. Almost half of all caregivers reported a related financial setback, and they spend on average around 26% of their own income on care-related expenses. Many caregivers also have to leave the workforce early to provide care. Caregivers 50 and older who do this lose on average more than $300,000 in wages and benefits. Businesses and the economy are also impacted as well. Most caregivers work full time. Around 61% of working caregivers say that their care responsibilities impacted their job, often have to come in late, leave early, reduce hours at work, turn down promotions, or quit or retire early. When a working caregiver leaves their job, it can cost on average 1.55 times percent of their original salary to replace them. Next slide. To earn benefits, you automatically contribute 0.58% of every paycheck during your working years. You only contribute while you're working. Everyone is covered at the same low rate, regardless of pre-existing conditions. And starting in May, you'll be able to apply for benefits. You'll need to meet a contributions requirement, a care needs requirement. Once approved, you can choose on how you want to utilize your $36,500 benefit. It is a lifetime benefit amount that will continue to grow over time with inflation. You can choose any covered services that you want. There's no out-of-pocket costs. When you need care, we pay providers directly for the services that you receive, no copays or deductibles. Next slide. Everyone who's contributed to the WA Cares Fund more than 500 hours per calendar year is earning benefits. This includes those part-time or temporary workers. To qualify for benefits, you must have met the contribution requirement through one of our 3 pathways. First is what we call the permanent pathway. This will earn the full benefit amount by contributing to the fund for at least 10 years. The next is what we call the temporary pathway. This will earn the full benefit amount if you contribute to the fund for at least 3 of the last 6 years at the time that you apply for benefits. And next was what we call the transition pathway. This will earn you lifetime access to 10% of the full benefit amount for each year that you contribute if you were born before 1968. And so these workers can also earn the full benefit amount if they qualify through one of the other pathways as well. So, for example, if you work and contribute that minimum requirement 500 plus hours per year for 2 years, you'd earn 20% of the benefit amount, or roughly around $7,300. Next slide. This is what contributions will look like over the course of a typical career. That typical worker making around $59,000 a year, they would pay $29 in contributions per month, which adds up to just over around $10,000 in total paying into the fund for over a period of a 30-year career. To earn less in benefits than you contribute, you would have to make on average around $210,000 each year for 30 years. Next slide. To use your benefits, we must first determine that you need help at least 3 or more activities of daily living and will continue to need help for at least 90 days. The activities that we assess are bathing, bed mobility, transferring, toileting, mobility, eating, and medication management. We also understand that cognitive limitations can also affect a person's ADLs. So the care needs requirement was developed to ensure it also includes individuals who need assistance due to cognitive impairment, needing supervision, cueing, or reminders. Next slide. And when you're ready to apply for benefits, you'll start by creating an online account. You can have someone else help you manage your own account. Your local area on aging will also be available if you need more support as well. And once you submit your application, we'll confirm that you've met the contribution requirement. Then you'll be able to schedule an appointment to talk about your care needs. After we met with you, we'll let you know if you're approved to start utilizing your benefits. Next slide. Here are some upcoming milestones. Benefits will become available next year, and here are some key dates to be aware of. Before benefits roll out statewide, we will pilot our entire system in Lewis, Mason, Thurston, and Spokane counties with a limited number of applicants. Residents of those counties will also be able to apply since January 6th, and applications will close for the pilot March 31st. On April 1st, you'll be able to create an online account, which you can use to check your annual contribution statements and eventually apply for benefits. On May 18th, applications for benefits will be open statewide. And July 1st, all beneficiaries can start receiving services. Next slide. Starting in July, you can also choose to continue participating in the WA Cares Fund, even if you do leave the state of Washington. To become an out-of-state participant, you must contribute to the fund for at least 3 years, working that minimum requirement 500 hours or more per year. You must opt in within a year of leaving the state of Washington. Like other workers, out-of-state participants will keep contributing to the fund during their working years. We are working on a process for out-of-state participants to report their earnings and pay premiums with a focus on making it easy as possible for those individuals. Starting in July of 2030, out-of-state participants will also be able to access benefits outside of the state of Washington. At this time, I'll pass it off.
Hi, good morning. So once a beneficiary is ready to start using their benefits, they're going to apply and then with WA Cares, and then after they are deemed qualified, they can start using the benefit to access any of the approved services. So there are no additional eligibility layers. You can access any service that's an approved service, but you must use a registered WA Cares provider. And because this program is self-directed, There are no case managers. So you, the beneficiary, you find and contact providers on your own and decide who you'd like to work with. To do that, you can visit the WaCares Provider Network directory and find providers in your area. If you need help navigating the directory, you can call us at WaCares, or you can call your local AAA for support. And AAA is the Area Agencies on Aging. Next slide, please. Here's a glance at what the WaCares Provider Network directory looks like. It is hosted by Community Living Connections, and the information included for each provider is seen here. So you will see the provider's name, the service or services that they provide, the provider's contact information, and the languages that they offer. Next slide, please. Some general information about accessibility. So the directory is viewable on several devices. You can take a look at the directory using a desktop computer or a laptop, a tablet, or your cellular phone. There are some other accessibility features available on the site as well. There's screen reader compatibility, also high contrast and large print display options, and a translation tool. Next slide, please. How to search. You can search for providers by the service that you're interested in, or the location, or both. There are drop-down menus where you can select a service tile, or you can select a service tile. Location options will let you search statewide, so someone who serves the whole entire state of Washington, or you can search by your own county where you live and want to receive services. Next slide, please. On the site, there are several other tools that you can use to narrow down your results after you've performed a search. There are things like filters, or you can also print or email your results, or even see them on a map. This can be especially helpful if you're working with an outside entity and you don't have your own computer or internet access. Then you have something tangible that you can take home and continue to do your provider research. Next slide, please. And there are lots of resources available for this step in the process. You can visit the WaCares website. You can also contact us by email. We have a contact form on our website. And you can also talk to Community Living Connections. And if you don't have internet access, there are resources available where you can talk to team members at WaCares using the phone number shown on the screen. You can also call Community Living Connections at their phone number, and they can connect you with your local area agency on aging. The CLC, or Community Living Connections, and the AAA, they can also assist with things like transition planning, or if you need assistance at the application phase of beginning working with WaCares. All right, I'm going to hand this off to the next presenter.
Thanks, Chantel. All right, so once you've successfully navigated our provider network directory, hopefully you've been able to find more than one provider for the service you're interested in. And so you might want to think of, the process here as like, how would I normally go about finding a provider that I, need. So if I'm looking for a plumber or an auto repair shop or hairstylist, we're going to kind of talk about, how we encourage folks to compare providers you find on our directory. And it might be similar to how you do that in your day-to-day life. So to choose a provider to use, we suggest folks visit their websites. if it's available. Hopefully this is on the directory, but if it's not listed in our directory, you can, probably go online and just look up the company name to find their website. You could also or call or email the providers. That contact information should also be on the directory. And if not, you would find it on their website. Some of the questions you might want to ask the provider when kind of comparing who you'd want to go with might be just clarifying what services they offer, where they offer the services, what are their prices or their rates, and then, any other questions you might have for them about the service that you're looking for, or any, that might meet your unique needs. Next slide, please. So once you've kind of gone through and done your research on comparing the providers that you found on the directory, you'll move on to making a selection. And so some things to keep in mind when doing this, you'll want to make sure that your WACARE's benefit balance has enough funds to cover the services you're looking for. And our next presenter will go in to how you can check that through your WACARE's account. But first, you'll want to make sure, do I have enough benefit to cover what I'm needing from this provider? Then you'll want to decide which provider you'd like to receive services from, and contact them directly. As Chantel mentioned early on, we don't have case managers. It's really a self-directed program. Once you're eligible, you're free to contact providers and set up your services. So you would want to do that. Some things to consider when agreeing on services with the provider you've chosen. Make sure you're both very clear on what services you will receive from them. Make sure you're clear with that provider, any preferences or specific needs you might have, so they can make sure to account for that when serving you. Make sure you agree on and are clear on what the rate or the cost of that service is going to be. And then, of course, the dates of the service. When do you need this to start by? How long does it need to, how long do you need or want that service? So those are just some things to keep in mind when choosing a provider. Next slide. All right. After choosing a provider, right? So you've agreed on all those things with that provider. They are going to then submit what we call a pre-authorization for the services that you both have agreed to. So this, consider this kind of acting like a service agreement between the two of you. So this pre-authorization is going to include the service, the rate, and the date that you've agreed on. The provider then submits this. The pre-authorization is entered into the state's payment system, provider one. And so after that provider enters this pre-authorization, you will be notified in your WACARE's account that you need to take action. And it's at this time where you would review and make sure, yep, those are all the things that we agreed to. And again, the take action is, either approving, denying, or if you have other types of follow-up. I think that's all for me. I will pass to Janice. Next slide.
Thanks, Christine. So just like Christine said, once your provider submits that pre-authorization, you do get notified of that request for an approval or denial in your WalkCares account. And what I have here on the screen is kind of an example of what you would see on your account dashboard. The dashboard is going to include information like your available balance, the total cost of the pre-authorization that your provider submitted, which will be kind of subtracted from that available balance. And so when you get that notification that the pre-authorization is ready for you to review, you're going to click on the review button to pull up that request. Next slide, please. So when you get to the next screen, you're going to review your pre-authorization details to make sure that it's accurate, to make sure that it reflects that conversation that you had with your provider. Just like Christine said, you want to make sure that you take a look at things like the rate, the dates for those services, and just all of that information. And if everything that you're looking at on the request matches that conversation, you'll then be prompted to approve or deny that request. And there are two buttons. So the you'll click one of those again to approve or deny. And then it'll take you to the following steps here on my next slide. Next slide, please. So to approve, you click on the approve button there, and you'll get this confirmation screen that the pre-authorization has been approved. Once you click on that button, you'll get a pre-authorization number, as well as this back to benefits activity button, which would take you back to the previous screen. Now, when you do approve the pre-authorization request, your provider actually will get that approval pretty quickly. It's near real time, so they should get that response within minutes after you've clicked that button. Next slide, please. To deny your pre-authorization, it's pretty similar to an approval in that you'll click on the denial button, and the next screen will ask for a denial reason. So it's a drop-down menu. So you would choose one of the reasons for your denial, and it could be things from like there's a error in the details. So they may have asked for maybe more dates than you had originally agreed upon. It could be a case where, maybe you've decided to go with a different provider. So there are different options for you to choose from when you're denying that request. Next slide, please. After you choose your denial reason, you click on Deny Pre-Authorization, and then you'll get a confirmation that you've denied the request. And again, your provider is going to receive that denial so that they can take next steps from there. Next screen, please. So after you've approved or denied your pre-authorization, again, you'll see that back to benefits activity button, which will take you back to your benefit activity page. That screen or that kind of dashboard will again show you your available balance that you have to work with when it comes to utilizing your benefits. You'll also be able to see things like your pre-authorization history. You'll see past requests as well as the statuses. So you'll be able to see previous requests that you've either approved or denied. And you can even go further and click on the view details button so that you can even see more details like the actual date that the services were for. You'll see things like when the provider got paid, So just something that you can utilize if you're tracking all of the pre-authorizations and where your benefit dollars have been going to. Next slide, please. So again, benefit activity page. This is a different kind of view of your dashboard in that you can click that button that you see circled on the screen. That will take you to the exact same screen that you saw in the previous slide. So there are different ways that you can get to the details page from your dashboard. And so we wanted to make sure that your WalkCares account dashboard was pretty easy to navigate, pretty intuitive. And so the different ways to review your benefits and your pre-authorizations, we tried to make it as user-friendly as possible. Next slide, please. This is just another view of your benefit activity page. Again, you'll see your available balance, pending pre-authorizations that are waiting for you to make a decision on, and then down below the activity history. Next slide, please. And that's it for me. Thanks, everyone.
Great, thanks, Janice. Now we're going to move on to the Q&A portion of the webinar. If you have a question, feel free to add it into the Q&A function at the bottom of your screen. You can click on the Q&A button and enter your question in there. I will also be asking questions from the registration form. So if you submitted a question ahead of the webinar, I will read through those now as well. So we have one question, Chantel or Christine, how do you become a provider and be included in the provider directory?
I can help answer that. So our provider applications are online through our WalkCares website. We've got a provider information page, and you'll see at the top there an apply button. We encourage any provider interested in registering with WalkCares, though, to first visit our provider toolkit at the bottom of that page. This toolkit is going to provide information about our covered services, minimum qualifications for providers, and just what those services will look like within our program. And so that would be the best place to go if you're interested, again, in providing services. Go make sure what you offer is covered and that you meet our minimum qualifications. And then you can apply and go through our application and contracting process.
Thank you. Where can somebody find the qualifications for providers?
Yeah, I'll say it's again on our website in the provider information page. You'll open up the menu, scroll down to provider information, and then you'll go down into our toolkit and you will see several documents that will outline what the qualifications are for each of our service providers.
Thank you. There's a question from the registration form that says, can you become a caregiver at any age and for any person in your family?
Yeah, so for our in-home personal care services, WalkCare's beneficiaries can hire family members, friends, etc., through Consumer Direct Care Network Washington, or CDWA, as a lot of folks know them as. And with WalkCare's home care agencies will actually also be able to hire family members. I I am not sure about an age restriction with home care agencies. I do know that CDWA, you must be 18 or older to become an individual provider with CDWA.
If they are working for an adult family home or assisted living, will they be contracted through CDWA?
No, they'll be an employee of that adult family home or assisted living facility.
Is our provider applications currently open to the public or only if you live in a pilot county?
Our applications for providers have been open since October 1st for everyone in the state. We are asking within that application, though, if you serve a pilot county and if you're interested in serving during the pilot. So applications are open for everyone, with the caveat that we are only serving those pilot counties right now.
Is the provider directory available to the public now or only for pilot counties?
It is. It became available and went live on January 6th, the first day of our pilot. And keeping in mind, the pilot is where we're testing and learning things about our systems and such. And so it is live, and we're just looking to see how it's accessed and used to prep more for launch.
If a beneficiary does not have internet access or is unable to use a computer, are there ways they can get help finding providers?
I can answer that. Beneficiaries can call WACARES. We have a phone number on our website. They can also call the AAAs. The AAAs service and support various counties across the state. And so if a beneficiary needs support with that, they can find the AAA in their area. They could also contact the Community Living Connections if they need help figuring out which AAA it is that they should work with. And they can help with applications.
Janice, this one might be for you. How can somebody make corrections in their account to their profiles?
Yeah, so to make a correction in their profile, I'm assuming that they're currently contracted with WellCare Funds. So you can either contact the contract manager here at WellCare's, or if they are what we would consider an NPI-based provider, you can contact the healthcare authority to have that updated in the system.
Can you use your benefit amount for medical equipment and a caregiver, or do they have to go to one place?
I can tackle that one, Sam. Yes, you can use your Walker's Fund benefit to cover any type of medical equipment, medical supplies. We just do not cover any type of medical treatment.
Great, I'm just checking the registration form one more time. We still have a few minutes. If you have some additional questions, you can add them in there. If there are no contracted providers in my area for service, can I use a non-contracted provider?
You could not, but if you did find a provider who was offering a service you needed in your area, you could recommend that they register with us. And so maybe you could, give them our contact information, or they could reach out and become a registered provider. I think also, if that doesn't work out, reaching out and letting us know that you're in need and we are working on recruitment and outreach for providers throughout the state. And so if we do have a gap, yeah, we'd like to hear from you.
Perfect. I'll give just one more minute if anybody has any last questions. And if you have a question after this webinar, or if you watch the recording of the webinar and have some questions, you can email us your question directly and we'll respond to you by email. Next slide. As soon as you close out of today's webinar, a survey will pop up on your screen. If you could take a minute to share your thoughts about today's presentation, we would really appreciate that. Next slide. And if you are interested in attending a future webinar, all of our upcoming webinars are available at wahcaresfund.wa.gov/webinar. There you can also find the recording of today's webinar along with the slides from today's presentation. If you do have questions, you can contact us by email at the URL listed below, or you can contact us by phone at the numbers listed below. Thank you all for joining us today, and we hope to see you in a future webinar.